We press on for you because it's our mission. Dedicated to investigation because the facts matter. Fueled with determination because it's our calling. Driven by passion because you deserve to know what's really going on. Please support real journalism.
Welcome to our fall Aging in Atlanta virtual event. Our panelists will be speaking on a variety of topics: estate planning, health and wellness, immunizations, and senior resources. Everyone will make their own introduction, and then I'll have a conversation with each panelist for a few minutes. First, a few words from our presenting sponsor, Kroger.
Kroger is a proud sponsor of the Aging in Atlanta series. As we head into the flu season, Kroger is as committed as ever to serving you and your family's health. No one should be left vulnerable to the flu, so don't take the risk. Get your free flu shot today at Kroger and protect your loved ones from the flu. Visit Kroger.com/flu to schedule an appointment. That's Kroger.com/flu. Kroger, fresh for everyone.
So I'm going to let our panelists introduce themselves. First is Michelle Blaylock.
Hello, everyone. Thank you for having me back on this panel. My name is Michelle Blaylock. I am a pharmacy manager at Kroger Pharmacy. I have over 20 years of clinical pharmacy experience, including managing and other operational and clinical details. I specialize in medication therapy management, geriatric care, and point of care testing in our community. I'm very passionate about our community pharmacy and keeping our patients healthy. So I look forward to our panel discussion today.
Thanks, Michelle. And now Dr. Bloom.
Hi, I'm Paula Bloom, and I'm a clinical psychologist. I work at Kaiser Permanente, and I'm the South Area Behavioral Health Chief. I'm delighted to be here. I've been working in behavioral health for over 20 years. I've worked in a lot of different settings, from the VA to college counseling center to inpatient medical units to outpatient mental health. Currently, I work as an integrated behavioral health consultant at Kaiser Permanente, which means I'm a psychologist embedded in primary care. I'm there to help support the total health of people. I will say this: when I left grad school, I realized I knew a lot about mental illness and not a lot about mental health. So my career has really been focused on being able to learn more about mental health and help people in that way.
It's good to have you here, Dr. Bloom. And Shannon.
Good day, everyone. My name is Shannon Pauley. I'm happy to be returning back to this panel. I am the owner of the estate and asset protection law firm. I am an attorney with over 20 years experience, dual state license in both the states of Georgia as well as Michigan, and I do have a master's of law in tax. I'd say that my focus and my passion began in high school and college, where I was a nursing home volunteer, where I saw the difference between the persons that were the haves and the have-nots, and most of the time that was based upon estate planning. And I'm looking forward to sharing a little bit of that knowledge with you to make sure that y'all guys are the haves, not the have-nots.
Well, thank you. And another new panelist, Dr. Baldwin.
Good afternoon, everyone. I am Dr. Fiona Baldwin, and I am an adult primary care physician with Kaiser Permanente. I am also a lead physician for the South Service area, and we service the Henry, Fayette, and Noonan counties. And I'm also a physician trainer for BLS mock code simulation. I've been with Kaiser Permanente for 8 years, but in clinical practice for just over 20 years. I did my training in Pennsylvania at Lehigh Valley Hospital, and after that, I worked at a major hospital system in southern New Jersey before moving to Georgia about 10 years ago. I truly enjoy the work that I do at Kaiser Permanente. I love their model of integrative healthcare, right care, right place, right now medicine. And it truly aligns with how I think that we should practice medicine today. So thank you so much for having me.
It's great to have you. And Brendan.
Hey, Kevin, thanks again for having me back on. Again, my name is Brendan Underwood, and I've been the outreach coordinator for Georgia Relay for the past 6 years. Georgia Relay is a state program that provides no-cost telecommunication services for individuals that are hard of hearing, deaf, have difficulty with speech, or who may be deaf and blind. As an outreach coordinator, I look for opportunities to educate and share information on the state program and its services. That can be in-person opportunities such as community events and presentations, or virtual opportunities such as meetings or webinars. But again, thanks for having me, and I look forward to telling you more about our program.
It's good to have all of you, and thanks so much for being here. Michelle, we're going to start with you. We got to know you this spring at one of our events, and it's hard to believe, but flu season is, I think, just about upon us. So we're going to dive in on that. So let's start with a really basic first question. When is the best time to get that flu shot?
Great question, Kevin. And the perfect time is now. So the CDC actually recommends that you are to get your flu shot anytime between September and definitely by the end of October. However, there are some additional considerations that you might want to think about when you get your flu shot. So it does take about 2 weeks to get the maximum effectiveness of the flu shot. So that's something you might want to think about as you're traveling this season or visiting with other family members. Especially for ages 65 plus, you want to make sure that you don't get your flu shot too early. You might hear flu shots coming out in July or August. However, that might be too soon for you to get your flu shot, as you want it to last the entire season. Typically, the peak of our flu shot season is going to be through December through February. But however, sometimes we can see cases as late as May. So you want to make sure definitely by the end of October to get that flu shot on board to last you the entire season.
You know, Michelle, with all that's happened over these past couple years, I've never had to think about managing different vaccines and shots and things that I have to get. So, I mean, if I'm going to get a COVID vaccine or maybe even a booster, do I need to do that when I get a flu shot? Should they be separated? I mean, how do I manage the timing of that?
Sure. That is another great question. As we approach flu season, we've also got COVID shots happening in stores as well. So the recent guidance has suggested now that if you are due for your booster vaccine, or in fact, you haven't even gotten your COVID vaccination yet, you are eligible to get them at the same time. However, I would caution you to maybe put each vaccine in different arms. That way, if you do happen to have a reaction from a vaccine, you're able to determine which one that would be. But I encourage everyone, if you have not gotten that COVID vaccination and that flu vaccination, to make sure that you get that on board as soon as possible.
So I'm going to combine a couple questions here, just because I know from talking to you in the past, you really want people to be super clear. So does the flu vaccine protect me from COVID? Does the COVID vaccine protect me from the flu? Can either of them make me sick? I mean, there's just a lot for people to think about and understand. So straighten me out on that.
Absolutely. And it's pretty common with a lot going on as far as the COVID vaccination fears and flu shot fears. There's a lot of misconception about some of those ideas and what happens when you get a flu and COVID vaccination. So the flu shot actually does not provide any protection against COVID, unfortunately. However, the flu shot does provide protection against other illnesses and can help reduce doctor visits and keeping you out of the doctor office during this busy flu season. I think in the year 2019, 2020, the studies showed that it reduced flu illnesses by 7.3 million cases and even 6,300 preventable deaths of flu. So it is important to get that flu shot. Although it doesn't provide protection against COVID, it will help reduce those office visits. The other studies also show that the flu shot can reduce the incidence of people with chronic conditions. So if you have cardiac events, if you have COPD, if you have diabetes, it can help reduce some of those complications from those as well. As far as the flu shot making you sick, I know a lot of people don't want to get the flu shot because it makes them sick or they get the flu. You can actually not get the flu from the flu vaccination if you're getting a flu shot through a syringe. So those are inactivated flu shots. They do not cause the flu. People will have side effects from flu vaccinations, and that's pretty common. So you might expect a sore arm, a little bit of redness at the injection site. You could also have a little bit of cough. Sometimes people even get a little bit of fever or body aches. However, those just last about a day or two. You're welcome to take any type of medication that you have for pain, if you have some at home, Tylenol, Motrin, whatever you have, to alleviate any of those minor symptoms that you have.
Thanks, Michelle, for all of that and clearing that up. Now, again, never has it been more on our minds about protecting ourselves and protecting our loved ones from becoming sick. So what else can we do? I mean, obviously vaccinations are key, but what else?
Sure. And these are simple things that we can even incorporate into our daily routines that we're probably already doing, but probably should just be more mindful of as we approach the flu season. So a lot of those things would be avoiding people that happen to be sick. So you would want to stay away from any close contact with people that might be having some of those flu symptoms. As people approach the cough season, make sure if you're going to cough or sneeze, maybe cough or sneeze into a tissue and then throw that tissue away to prevent any germs. Germs spread a lot of that way. Also, I would say reduce contact between your nose, your eyes, and your mouth. Those are very, very, very prominent sources for germs and to be able to spread germs. Also, clean your surfaces. So any surfaces that you might have, you might want to clean them down often to make sure that we're not spreading germs that way as well.
Now, I know from talking to you in the past that you have some good advice on, I guess, the relationship with our pharmacists. I mean, I'm the kind of person who rushes in and out and grabs my prescription, but your advice is to do more than that when it comes to your pharmacist, right?
Absolutely. So I am a huge advocate for having a personal relationship with your pharmacist. You should utilize your community pharmacist for so many different health topics that you could actually resolve at the pharmacy. So if you're having maybe an issue with your lids at your medications you can't open, we can offer solutions for easy lids. We can help you with adherence programs to help you educate yourself more about your medications, about your side effects, and how to become overall healthier. And as you know now, we're your vaccination stop place as well.
Okay, well, thank you for all that information, Michelle. Obviously, really clearing up some things, and even I think doing a little myth busting there. People sometimes hear about things, and it's great to hear from directly from a pharmacist who knows about vaccines and the best way to take advantage of the medicine that's available to us. So thank you. We are going to take a moment here to hear a message from Kaiser Permanente.
Hello, I'm Joe Mays, and I'm your local Kaiser Permanente Medicare advocate. I'm local to Cobb County, and on the weekends you might find me out on one of the many beautiful trails around here, but I'm proud to serve you wherever you're located in the metro area. As one of the nation's largest not-for-profit health plans, Kaiser Permanente's sole mission is to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. We accomplish this by combining care and coverage together, which makes us different than your other healthcare options. If you want to learn more about how care and coverage together can help you build a healthier future, please contact me at joseph.w.mays@kp.org or 470-512-7661.
Welcome back. Dr. Bloom, we're excited to have you on the panel for the first time. Thanks for being here. And we know our audience is always interested in learning more about mental health. So let's start in a very basic place. When it comes to our own mental health, what should we be paying attention to during these stressful times that offer us clues when we might need to seek the help of a professional?
So I'm so happy to be here. Just like when you go to your primary care doctor and they take your physical vital signs, right? They take your temperature, your blood pressure, your heart rate, those types of things. Those of us in mental health take your emotional vital signs. What are those vital signs you should be looking at? Your mood, your concentration, your ability to focus, your sleep, your appetite. Those are the things to keep an eye on to see what's going on with you. And what you want to focus on with that is, everyone gets sad, everyone gets irritable. The question is how sad, how frequently, how severe are the symptoms, right? When it comes to issues with concentration and focus, these have been really difficult times. And so people are distracted. That's normal. The biggest, most important question to look at is how are you functioning, right? If things are affecting your mood to the point where you're isolating, you're having a hard time doing the things that would keep you healthy and happy, you may want to ask for help.
And how about how the pandemic's affected mental health professionals and how you're doing work and what's going on there?
Thank you so much for asking that. I have to say, this is the first time in my career where I've been experiencing the same kinds of trauma at the same time as the patients that I work with. And it's been really interesting because, if anybody has kids or has ever given advice they don't follow, I have a career of that, right? Of making recommendations and then not always following them. I have found myself listening to what I have to say to others more often. It's been really hard. I'll be really honest. It's been really hard. We've been really slammed all over the country, people in mental health. But what I will say is that for many of us in these moments of difficulty and powerlessness, being able to be useful, being able to be helpful is really important. And so that's actually been really helpful for me. And that's what's really helpful for all of us. We all need to have a sense of usefulness and purposefulness in our lives. But I will tell you that it has been hard. And thank you for asking.
Well, sure. I mean, I think that we all know that, right? I mean, at times like this, we want to make sure that we're engaged with others. We're part of something that matters to us. We're doing things that matter to us, right? I mean, that's really helpful at a time like this. Now, as you know, we always ask our readers and people who come to these events to give us some questions. So I've got this one, and it's really good. So I'm literally gonna read it to you. People would like suggestions for seniors battling depression and isolation as they cope with other health challenges and as another holiday season approaches with COVID-19 still in our midst.
Yeah, thank you for that question. One of the most important things about that question is that somebody's acknowledging that they're struggling. There's so much stigma still around mental health issues. So for somebody to be able to acknowledge that they're dealing with depression, that's a really, really important first step. So one of the things that I would say is that if you are struggling with depression, not just sadness or stress, but depression, you're having a hard time functioning, make sure to reach out to a primary care doctor or a mental health provider to get some support, because one of the symptoms of depression is a feeling of hopelessness, a belief that things can't get better. That's a symptom of depression. So often people don't even reach out for help because they don't imagine a time where they could feel better. What I would say about the isolation piece, I know a lot of people are having Zoom fatigue and technology fatigue, but I would say weigh out the fatigue from technology with the power of connection with other people. I think it's really important. Another thing that can really help with isolation is to write letters or do things for others to get out of yourself. That's actually a really, really helpful thing to do, right? Is to sort of focus on others. Another thing that is also very helpful when you're dealing with these kinds of feelings, we often tell people, hey, stay present. It's really important to stay in the present. Sometimes the present stinks, right? So one of the things that can be really helpful is something that we talk about, which is mental time travel, thinking about a time that you kind of really enjoyed and felt connected and sort of conjuring that up. We often relive negative experiences and play them over and over and over again. We can do the same thing with positive things. We can savor things that have happened to us before. We have a really good imagination. We don't know the difference sometimes between something happening and us remembering it happening. And so those are some of the things that you can do kind of in the present and reminding yourself everything passes, every feeling, good and bad. So the bad feelings are going to pass, the good ones, enjoy them because those are going to pass as well.
That's great advice. Now, another one of our readers wants to know if there are any resources or even apps that you suggest for older patients to help support mental health.
Sure. I think one of the most important resources is your phone, right? Most people have a phone, that ability to kind of connect with others and that kind of thing. There's some wonderful apps. Calm app is one that we use a lot. We recommend at Kaiser, and it is an app that really helps with mindfulness, the ability to stay present and engaged. I was talking about being present earlier. Things that help with breathing, relaxation, those things are really helpful. Another thing that's really helpful, gratitude, because our brain is sort of primed to go to the negative. It's an evolutionary thing, right? Like focus on the negative to keep yourself safe. If you establish a gratitude practice, and there's a lot of apps that you can do that with, it really helps because it helps you to shift your brain to a place where you want it to be. It's hard to tell yourself not to worry. It's like setting your GPS to where you don't want to go. You have to set your GPS where you do want to go, and your mind works the same way.
And I think we've got a time for one more. So connect physical and mental health for us, how they impact one another and what clues one offers you about the other.
Sure. That's why I love my job, actually. That's exactly what I do. I work in the clinic with Dr. Baldwin. She's one of my colleagues. So when she has issues with patients and they're having stress or depression and those kinds of things, I get brought in. So it's kind of really exciting. These things go hand in hand. The mind and the body, the division is arbitrary, right? They're really very much connected. But the way that mental health affects physical health is when people are depressed, right? When they're struggling, they don't have the energy or the ability to take care of themselves, to eat the food that they need to eat. That takes work, right? That's why, for example, treating depression helps manage diabetes when people are dealing with both. The other way that sort of your emotional health affects your physical health is that when you are anxious and worried and ruminating, you may not be sleeping very well. Sleep is really important, especially as you age, right? Making sure that you're able to sleep in the ways that you need to sleep. The way that mental health with the way that physical health affects mental health, right? And this is really important. We never want to assume something psychological when there might be something medical. So it's important if you're having chest pain, discomfort, don't assume, oh, I'm just anxious, right? You want to make sure that you go to see a doctor and get that ruled out. But the connection between the mind and body, it's seamless.
Okay, I'm going to ask you this question. So because I think we have time for more. This is such great information. Give me, of course, all of our folks watching, just one little thing we can do that you really believe would help our mental health. Something simple that anyone can do.
Writing. Getting stuff out of your head, getting it on paper. There's something about if you've ever had that experience of talking about your anger or talking about your anxiety, you notice that speech can often magnify. Listen, I'm a psychologist. I'm a big fan of expressing and venting and doing those kinds of things. But writing is one of the most powerful tools that you can use to get stuff out, to get it through you and get it out. I would say writing and movement, if you're able to do that.
Well, thank you. Thank you so much for that great advice. We really appreciate it. And it's great to have you on the panel. One of the other things we want to do is thank Kroger, because we'll be drawing 2 random winners of a $50 Kroger gift card from those of you who registered for the event today. You'll be notified if you're a winner after the program. Next up, let's welcome back Shannon Pauly. I have to say, Shannon, there's no shortage of topics for you to cover with our audience, and I want to start with the very basic one.
Certainly.
We hear that word probate, and it almost like a bad word, and that we want to avoid it. But explain what it is, and why people can find themselves in a tough situation when that word's around.
Okay, so excellent question, because a lot of people, they have grown up, they've been hearing, you want to avoid probate, you don't want your estate to go to probate. Probate is another example of a 4-letter word that just happens to have 7 letters. So let's talk about what probate is. So probate is essentially the legal process of being able to transfer ownership of assets owned by a decedent at time of death to the ultimate beneficiaries, either declared within their will or as determined under the laws of intestacy if they did not have a will. Now, probate as a procedure, there's many reasons that you want to avoid it. First and foremost is the sacrifice of time. So for probate, in a perfect world, which I must add we've never lived in, but in a perfect world, it should take no more than 6 months to go through probate, because there is a notification process to creditors and debtors, and then there's distribution, notification, till the point of ultimate dismissal. However, COVID has put a very serious monkey wrench into this timing delay. We have certain counties in Metro Atlanta right now that when you file, they're telling you to expect up to 3 years due to COVID delays. So that's first and foremost, because your whole goal after your passing is for your legacy to continue on to whoever you declare that you wish to receive your assets and your acknowledgments. Now, other negatives for having to go through the probate process is, number one, everything is public record. This is the reason that, for example, when Whitney Houston passed away and her probate attorney filed the probate action, it was all over the news within 15 minutes of it being filed. It was on TMZ, Entertainment Tonight, the morning talk shows, etc. And at first you may go, whoa, that is such an invasion of privacy. That is not good. And here's my comment. The moment that the attorney released over to the clerk the petition for probate and the clerk took it into their possession, it became public record. And that's why there's nothing improper or illegal in that being disclosed as quickly as 15 minutes after it occurs. Now, as I say, it's public record. You have to realize that the entire process is public record. So if you have anything in your will that you don't want to have as public aired laundry, you definitely don't want to go through probate. For example, if you have a child that has addiction issues and you are either not wanting to give anything to that child, or you want that child's inheritance to go through like a subtrust, a testamentary subtrust, you may not want anybody to know about those addictions. And then the last reason that I would emphasize as to why you want to avoid probate is because of the added expense. So we've talked about added time. We've talked about the lack of privacy because everything's public record. Let's talk about the expense here. So number one is you're probably going to hire an attorney most likely because chances are you've never gone through the probate process before. And if you have gone through the probate process before, and definitely if it's been more than one time, I feel sorry for you because it is a very tedious experience for anyone, especially when you have an emotional connection with the decedent. But you're going to pay court costs, attorney fees, you're going to pay publication fees. Oh yeah, guess what? Debtors and creditors, they get paid before your heirs. So they might fleece your entire estate and nothing goes to your ultimate heirs. That is why I emphasize to people, you want to avoid probate, and there are estate planning strategies to do just that while preserving your estate for your loved ones to ultimately receive it in a much prompter manner than having to wait up to 3 years.
We have a question from a reader, and it's very well put, so I'm just going to read it to you. The only asset in my sole name is my home. Should I transfer my home to my kids during my lifetime to prevent them from having to go through probate after I'm gone?
So one of the reasons that you want to talk to an attorney, because this is a very good question, Kevin, and this is one I hear quite often, because what we'll have, I call kind of like you would call them Monday morning quarterbacks. You have individuals that will always share information, especially in our Google age, where they'll have people talk about, oh, you don't need to go to an attorney. You can avoid probate yourself. Well, my first comment is this. By placing another person on the title or transferring title during your lifetime, yes, 100% that could avoid probate, especially if you put another person on the title as joint tenancy with right of survivorship. But let me tell you why you don't want to do that. Now, by coming to an attorney, we are looking at you from multiple facets, and we're always looking at tax advantages and strategies. And if you were to, for example, in my example, let's say you purchased the house for $1, and let's say on the day that you transfer it to your children, you put your kids on the title, it's now worth $10. Now realize that your children took what's called a carryover basis, meaning that when they sell the home, they'll have gain, the equivalent of the $10 selling price minus the $1 basis, meaning if you do basic math, they would have $9 in gain. Now, if instead we went through a will or a trust where it was going to be distributed to your loved ones or your children in that process, the beauty that they have now is what's called a step up in basis, which means that instead of them taking the home with a basis of $1 when it's worth 10, which could be up to $9 in gain in my example, instead they're going to take date of death value, which means they take it at $10. So if they received it with the value of $10 as date of death and they sell it for $10, they have zero gain. And this is how you can assist the preservation of your estate for your heirs by being able to do basic processes through estate planning, which have fabulous tax advantages.
Here's another question from one of our readers. As a new resident of Georgia, do I need to have my estate plan rewritten?
Excellent question. Very often I do have individuals that recently moved to Atlanta because Atlanta is definitely a destination location for many persons in their professional life. And my comment to it is this: does it have to be redrafted? No, just because you've moved does not automatically mean it has to be redrafted. However, I would emphasize that you do want an attorney to review it, because what the attorney is going to review is to make sure that the documents as drafted in the other state will still meet the statutory and court rule obligations for the current state. An example I very often give is in regards to wills. So there's certain states that recognize what's called a holographic will. This is those TV shows that you see where it's the person on the overnight trip for business and they meet some sweet person in the bar and they say, oh, honey, I just want to have a night of wonderfulness with you. And I'm going to write on this cocktail napkin here saying that, I want everything to go to you, my love. Even though it's the first time meeting, they have their night of passion or intriguement, whatever we want it to be, and then they pass away. Well, there's certain states that will recognize that as a will, which means that would trump even a legal will in certain states. Well, in the state of Georgia, we don't recognize holographic wills. Instead, we have to make sure that they are signed, they're witnessed, they're dated, and you also want to have something called a self-proving affidavit so that your witnesses don't have to testify at probate court when it's being probated. So in just that simple example of a will, how it differs between states, that's why you want your documents reviewed, not necessarily redrafted, but that's why you want the expertise of that attorney reviewing.
Shannon, if all my assets have a pay on death beneficiary, do I really need a will or a trust or either?
Very good question, because it is true. A lot of times individuals, the greater part of their wealth is their qualified retirement accounts, like an IRA, 401k, or it might be that life insurance that you have. These actually do have pay on death beneficiaries. But here's my comment though. Yes, that is avoiding probate. Yes, that is getting to your declared beneficiary, but it's not protecting your beneficiary in the event anything may be happening to that person. For example, if your beneficiary, let's say it's your spouse, and at the time you originally declared them out to be the beneficiary, they were healthy, but life has happened. And now they've had a catastrophic life event, and we've had to go through the process of qualifying them for Medicaid, which has asset and income thresholds. Well, you don't want them to be receiving directly that inheritance, or that insurance. You want it to actually go through the trust or the will, for example, because then at that point, it can be placed in what's called a special needs trust for the benefit of that individual during their lifetime, but it's not going to have a detrimental effect, creating a disqualification for a governmental benefit. So for that reason, while the pay on death does avoid probate, just like that example we gave about the real estate, it's still far more advantageous to have it go through the will or the trust, because you're going to be able to continue your love and your protection of your beneficiaries by ensuring that whatever happens to them at the time of that distribution, that they are protected, especially in that example of a special needs person.
Okay, well, thank you so much for all that information. As always, Shannon, you have so much good information. We could keep talking, but I want to get to one of our new panelists, Dr. Fiona Baldwin. So welcome to the panel for the first time, and to discuss preventive care and maintaining our health. So let me start with this question. Tell us a little bit about your experience treating senior patients and how you approach it.
Absolutely. So yes, so thank you again for having me. As I said, I am an adult primary care physician with Kaiser Permanente. So that means my panel really starts at age 18 years old. But I would truly say about a third to maybe even a little bit more than that of my day's work is with patients who are 60, 65 and older. So I see a good majority of those patients every day. In this capacity, I take care of their chronic illness. That would really encompass your hypertension management, diabetes, high cholesterol, any of those heavy hitting chronic diseases. So from diagnosis straight through to treatment, I manage that on a daily basis. I'm also involved in their senior wellness preventative exam. So not only am I doing your preventative care at that senior wellness exam, but that's a slightly different physical where we really are interested in how you're functioning, what's your critical thinking, what's your understanding and reasoning. So you may notice that at that physical, you're getting a couple tests here or there to test your memory or to test your higher thinking. And you might be surprised by that, but expect that at your senior wellness physical after 65. Another integral part of my day's work with seniors is I think I act as a liaison for them. I act as their advocate a lot of times as well. Sometimes they enter the hospital for hospitalization, and that's a confusing time for them. Sometimes they don't really know what went on. I'm able to, review records with them, review any tests, or if they've seen any specialists, sometimes there's a lot of follow-up that has to follow that. And a lot of times our seniors are, they get very bewildered by all the tests that they have to get done. So I just make sure that follow-up happens.
Well, thank you for that. When people experience changes in their health, sometimes it's normal, as we age, and other times it's a sign that we ought to see the doctor. So can you give us some examples of each, that we should come to recognize?
Absolutely. So this can be a very confusing gray area for patients and their family members. And suffice it to say, aging can affect every single organ in our bodies. So, but I am here on the program today to reassure you that mild forgetfulness is not dementia. I mean, we expect to occasionally forget a name or forget a word every now and then. You open the pantry door and you can't remember what you went in there for. That's normal. That happens to all of us. But when you're noticing a decline in something that's familiar, so dad has been driving to church, the same church for the past 30 years. And now he's getting a little confused with how to get there or how to get home from church. That's a problem. That's definitely something that you need to be mindful of, that something may be going on with memory changes there. If mom makes the family recipe every Thanksgiving and now she's adding some odd ingredients to it, or she's forgetting some key ingredients, that's not normal, because that recipe has been passed down for generations and generations. She's been making that for years. If she now has some struggles with making a common recipe like that, I would say that that's time to see a doctor. In terms of heart disease, I always like to tell my patients that mild shortness of breath when you exercise can be normal based on your exercise level. But if you are in a group activity with a group of your peers and you are visibly short of breath, or you have to stop, or you're having chest pain, and everyone else seems to be quite comfortable with the exercise routine, that should signal that, you should have a conversation with your primary care physician about that. And like I said, aging can affect every organ in our body. So another common concern I get with my patients is they're concerned about urinating too much. So we expect the bladder to kind of cause us to have more frequent urination as we age, because the bladder muscle loses its elasticity, and the pelvic floor support muscles that support the bladder, keep your bladder healthy, they start to weaken. So you may notice that you're using the bathroom a little bit more frequently than normal. That can be normal. However, if you're noticing that you're having excessive urination, and particularly if it's associated with increasing thirst, that could signal something like diabetes. So I would certainly get that checked out.
Well, thank you for that. Another question from one of our readers who wants to know what screenings seniors should be prioritizing now if they've neglected routine care because of the COVID-19 pandemic.
Oh, what a great question, because the pandemic really has us as healthcare professionals, scared and nervous for our seniors that are out there, afraid to come into the office. Many people have neglected coming into the office for fears of contracting COVID-19. So definitely a lot of our screening care that we usually would have up to date has been delayed. So the first thing I would do, now that offices are opening up again, make an appointment with your primary care physician. Go in there. Have your blood pressure checked. Have some lab work for diabetes and your cholesterol. Those types of things are important. If you're already taking medication, have your kidney function monitored. Those are things that we like to make sure that are still staying healthy, that you may have neglected because you haven't had lab work in over a year. Talk to them about your screenings for cancers. Having a mammogram, having a colonoscopy, and if you are eligible for any of the other cancer screenings, you may be eligible for, say, lung cancer screening or prostate cancer screening. Have that conversation, but go on in and have that visit pretty soon. And as Michelle was saying, it is flu season, so in essence, not only our screenings, but making sure that we update our vaccinations, because some of them might be out of date. You may be in addition to needing a flu vaccine or COVID booster, you may be eligible for your shingles vaccine or your pneumonia vaccine. So go ahead and make sure that you make that visit.
So Dr. Baldwin, one more question that I think we have time for. Because of the pandemics, people had their first experiences with telehealth. So talk about that and how it works and why it's growing in its use.
Absolutely. So I would definitely say everything COVID related was not bad, because we really got to experience this new phenomenon of telemedicine or telehealth. And I feel very fortunate having worked for Kaiser Permanente, because we already had telehealth and video visits incorporated in our daily patient load prior to the pandemic. So telehealth or telemedicine is really just a way to deliver and facilitate medical care that is outside of the traditional way of having a doctor's visit, which is a face-to-face visit in a doctor's office. So telehealth or telemedicine can be a video visit. It can be a telephone visit, it can be an email encounter, or some other form of remote monitoring, such as monitoring your blood pressure or your diabetes remotely. I would say that it's growing in popularity because really as a whole, we're busy people. So a lot of my patients, older and younger, enjoy having the opportunity to have a virtual visit. Now this means they don't have to take an entire morning session or afternoon session off work to see their physician, or a family member for our aging seniors don't have to take that time off work to take them to the doctor. So now you just have to excuse yourself, go to a quiet room or a quiet office where you can have a full-on visit with your physician. Typically, though, I would caution you that this is reserved for, mild conditions like getting your medications refilled, or if you have a mild upper respiratory infection. I mean, we can even see something like a rash or something like that on a video visit. And if there's a need for a more higher level of care, your physician at that time would be able to tell you, okay, no, I think this is a little bit more than a telehealth visit. Come on in for a face-to-face. And I would say at Kaiser Permanente, I think it's actually improved our access to care. Now through telehealth and telemedicine, I have access to specialists that I didn't have access to before. As Dr. Bloom states, we work together. So now I have access to her through telemedicine, and I can get my patients that right now appropriate, right here care to take care of their needs.
Well, thank you so much for that and for being part of our panel, Dr. Baldwin. It was great to have you.
Thank you.
Finally, we have a familiar face, Brendan from Georgia Relay. Sounds like you have some new things to talk about with us today, but why don't you start out with explaining what Georgia Relay is for those who are new to us?
Yeah, sure. Again, thank you for having me, Kevin. So Georgia Relay provides a variety of telecommunication services, and it's all based on an individual's needs. We are targeting those who are deaf, hard of hearing, who have difficulty with speech, or those who are deaf and blind together. And as it relates to our services, I kind of like to break it up into two different categories. So we have traditional relay services, and these could be services such as TTY or hearing carryover. HCO is the abbreviation for that, speech to speech or STS. But then we also have a second category of service, and that's caption telephone, which is we call CapTel for short.
Well, talk about what caption telephone is, and you said you call it CapTel, just so I got that right.
Correct. So CapTel is a wonderful service. The way it works is attached to the phone, you have a screen. And so as you're having a call, you're listening to the conversation, but on the screen, the captions of what the other person is saying appear. And so it allows for an individual who's hard of hearing to follow along without missing details or having to ask for something to be repeated. For me, prior to COVID, I used to do installations of these CapTel phones in individuals' homes, and I can tell you, it's amazing to see how it's so life-changing. I mean, sometimes there are people that haven't had a successful call in years, sometimes decades. And this is something that gives them the ability to have a successful call. So CapTel is honestly one of the favorite services that we provide. I like to talk about.
Well, I'm sure there are probably people who would be very interested in that for themselves or a friend or a relative. So I got to ask, what does it cost?
Oh yeah, that's a great question. The best part about CapTel equipment is that with the verification of your hearing loss, the equipment is free. So hearing loss, the way that works with the verification of that, there's a number of ways someone can go through that process. It could be your doctor, it could be a hearing healthcare professional. For veterans, they can go through the VA. And so with that verification, it qualifies you for one of several different CapTel phones that we have. And just kind of talking a little bit more about that, each phone essentially has the same features. We have one that the phone is kind of made to be more of a traditional phone experience. And then we have a second phone option that it has a touch screen on it. So for any individuals who are a little more comfortable with some of the newer technology, that would be certainly an option for them. Now, I mentioned that they basically have all the same features. One of my favorite features that I like to highlight is the built-in answering machine. And so if you choose to use it, what happens is it's going to caption the message of what the other person says. And this is crucial. You know, you have your family trying to get in touch with you. As we're talking about aging here today. You know, if your doctor's calling about an appointment or instructions on a medication, being able to hear that clearly is certainly very important. So, I always like to mention the built-in answering machine.
So what other services? I mean, you've talked about a couple of these, but let's just make sure I give you a chance to cover all the ground in terms of what people might be interested in or what would be particularly helpful to them.
Sure. We've kind of highlighted CapTel. But kind of to revisit the traditional relay services, earlier I talked about TTY, HCO, which is hearing carryover, VCO, which is voice carryover, and then speech to speech. And that's really one, I don't know if we have the time to get into each one individually, but speech to speech to me is something that I do want to highlight. So it's meant for anyone who has difficulty with speaking. And the example of someone that may benefit from this type of service would be maybe someone who suffers from a stuttering issue, or perhaps someone who has suffered a stroke and part of their speech has been lost as a result. The way it works is we have a specially trained communication assistant, and they will help by revoicing what the other person says. It's also a wonderful service because it doesn't require any specialized equipment. So as long as an individual has access to a phone, whether it's a landline or a cell phone, speech to speech is a service that's available to them.
And as the outreach coordinator, tell us a little bit about what you do and how people can get a hold of you and if they're interested in these things.
Sure. So the best thing to do, if you visit our website, georgiarelay.org, there's a contact button there in the right corner, and you can send me a message that way. And I think that's probably the easiest. And then as it relates to my job, as I said earlier, as an outreach coordinator, I've had the joy of traveling the state of Georgia for the last 6 years. And so I'm always looking for ways to connect with either individuals that could benefit from our services or those who help those type of individuals. So, we don't just focus on the individual that needs a service, but we also focus a little bit on businesses as well. And another thing to highlight there is our partner program. We've created this based off of feedback from our users. And so what happens is maybe they will call a business and experience a difficulty with their call. Well, we want to avoid that, right? So the partner program will go to the business. It will educate them on what is a relay call, who's using it, and ultimately how to have a successful call. And then from there, we'll kind of follow up with some marketing on our end and welcoming them to our program. So yeah, it's not just about the individuals. It's also making sure that businesses know how to take these calls as well.
Well, thank you so much, Brendan. As always, your explanation and the resources you help make people aware of are great. And we always like having you on the panel. So here's what we're going to do. We're getting close to finishing up, but I'm going to come back to each of the panelists and give you, let's just say 30 seconds each to just give folks watching sort of a parting thought, piece of advice, whatever you see fit in that time. And we're going to go in the same order. So we'll start with you, Michelle.
Yes, well, as Kevin mentioned, please make sure that your pharmacists are an integral part of your healthcare team. We love to work with your doctors, Dr. Baldwin and Dr. Bloom, to make sure that your healthcare is complete. Make sure to stop by, talk to your pharmacist about any issues that you may have. And also we can help you with those vaccines. So make sure to get that flu shot before the flu gets you.
Thank you, Michelle. And how about you, Dr. Bloom?
What I would say is that it's important to recognize that resilience is actually ordinary, not extraordinary, and that no matter what's going on, most people, even if they're struggling and they're stressed, are faring okay. And I would say that what's really important in these times is to take the time to connect with someone else. There's 3 things we need for happiness: doing things that we enjoy, doing things that keep us engaged with others, and doing things that give us a sense of purpose. It's really important to do those things.
Thank you. Shannon Pauly.
Emphasize that you as individuals have spent a lifetime accumulating assets, resources, and stories. It's important that you be actively involved in your legacy. And that legacy is not only going to be taking you down the course after your passing, but you've got to be prepared in case anything happens during your life also. So with that, I emphasize there's such importance with estate planning, and please know that we are here to assist you both at the estate planning law firm and in other locations.
Thank you. And Dr. Baldwin.
Yes, so I just want to remind everyone that upcoming October is Breast Awareness Month. So please, moms, take your daughters, daughters, take your moms, take your friends. Please go ahead and schedule that mammogram. And also for our aging seniors, I really want you to focus on fall prevention as well. This is something that can really affect our seniors. Turn the lights on when you're going to the bathroom, please. Don't just assume you know how to get there. And pick up those area rugs so that they can serve as a real trip-in hazard. So just making sure that you're mindful of fall prevention.
And Brendan.
Yeah, so just to wrap things up, I mean, I think that we've had a really wonderful panel here today, and we all are experts in our various, you know, different degrees. And I think it's important to make sure that you take advantage of us. You know, for me in my work, as I travel the state, oftentimes I hear, I didn't know something like this existed. So, you know, I always tell people, maybe you don't need any of our services, but oftentimes you know others who do. So, you know, and then to just apply that to everyone, just take advantage of us. We are in these professions because we love to help you all. So, thank you for having me today, Kevin.
In closing, we want to thank our presenting sponsor, Kroger, for making this program possible. We'd also like to recognize these partners of the Aging in Atlanta program. Thanks for joining us today. Be sure to visit ajc.com/aging for updates on senior living topics and a recorded broadcast of this event. You can also sign up for our new Aging in Atlanta newsletter. And finally, thank you to our subscribers. Your subscription supports our journalists. If you aren't a subscriber, join us. Go to subscribe.ajc.com and sign up today so you can continue to follow our reporting in the Atlanta Journal-Constitution and online at ajc.com.